Hello, I'm Dr. Christine Fisher. I'm a board-certified plastic surgeon specializing in cosmetic and reconstructive surgery of the breast and body. I'd like to talk to you today about breast implant selection for breast augmentations and breast lifts and for reconstruction, because I find a large number of my patients focus on the volume of the breast when we're talking about breast reconstruction or breast augmentation. Especially in breast augmentation, a patient will come to me and say, I'd really like to be a 310 cc because my friend is a 310. Or I love the way my other friend, she's a perfect C cup and she's a 345. But the question is, what is a 345? What is a 310? So I'd like to show you that. So here you can see 4 different implants, all very different volumes. All of these implants have the same base width or footprint. So two-dimensionally, when you look down from the top, all of them appear to be the same implant. But as you change your view, and you can see that although this implant is nearly twice the volume of this implant, they actually have the same footprint. So who is this implant good for? Well, this low plus implant is great for a patient who wants upper pole fullness, but a very natural look. A little bit deflated, but looking for a small augmentation. The moderate implant is good for the patient who's desiring a C-cup augmentation after nursing. The full projection is for a patient who wants a large C, small D augmentation, has a smaller breast, a little bit deflated, and finally the extra projecting is for the patient who really just wants to look bodacious. And so you can see here that although this smaller implant is a 235 and this larger implant is a 445, that we have a great difference in the volume, and yet the projection is really where it's at. But what patients often don't understand is that augmentation can bring the nipple up. So in the design of a breast augmentation, when we're trying not to do a scar around the nipple to bring the nipple up, we can use a slightly wider footprint of the implant, slightly wider, and that width of implant determines the amount of nipple elevation, not the projection. So it's not your total volume of implant that improves the shape and the natural projection of the breast, it's actually the width. The projection will determine just that. How round and how perky do you look? How cosmetic do you look? It's the width of the implant that really causes the nipple to move up the breast mound in a breast augmentation in which we're trying to avoid visible scars. I hope that this video helps you understand the importance of the footprint of the implant and the projection of the implant and how it relates to breast augmentation.